Alright, so I'm going to do a newborn assessment. So I have my uniform on. I'm going to do hand hygiene before entering the room. So now that I'm in the room, I'm going to identify the baby to make sure that I obviously have the correct infant. So I would use the identifier on the baby and then also like the crib or bassinet that's in the room. So once I make sure that I'm with the correct baby, I can go ahead and start my vitals. I'm going to take the temperature here in the armpit or axillary. The range for that should be 97.5 to 99. If I was getting ready to bathe her, I would make sure it's at least 98. I'm going to count her respirations. Those should be 30 to 60. Check her O2. That should be at least 90. 5 signs of respiratory distress would be, low battery. Seesaw, respirations, grunting, retractions, nasal flaring, or if she's having periods of apnea that are longer than 20 seconds. So I've got her temperature, respirations, O2, and then to check her heart rate, I'm going to listen to her apical pulse for a full 60 seconds. And then her heart rate should be 100 to 160. And then while I have my stethoscope out and have her uncovered, I'm going to listen to her breath sounds bilaterally. And then I'm also going to listen to her bowel sounds in all 4 quadrants. So I'll turn her sideways here. Alright, so I'm going to listen to her apical pulse. I would listen to it for a full 60 seconds. So I'll just say it's 120, so that's in between my 100 and 160 range. I didn't hear any murmurs or abnormalities. It was an even, regular tone. So I'm going to listen to her breath sounds. Okay, so her breath sounds bilaterally are clear. They're not diminished at all. They're regular, unlabored. So again, just listening to her bowel sounds in all 4 quadrants. Alright. So her bowel sounds were active in all 4 of those quadrants. So I'm just going to palpate her stomach real quick. Alright. It's round, symmetrical in shape and size. There's no distension. Her umbilical cord, I would say, is in the drying stage. But there's no discharge or redness around the umbilical site, so we're good there. Okay, so starting back up here at the top, I'm going to feel the fontanelles. So the soft spot on the top, the soft spot on the bottom. And then I'm also just feeling for the suture lines in molding. I'm not feeling any suture lines that are like overlapping. If the baby had a cephalohematoma, it would just be in one spot because that does not cross the suture lines. However, if the baby had caput succedaneum, then that does cross the suture lines, so it would be like all over the scalp or skull. So now I'm just kind of like moving the baby's hair and just inspecting the scalp for like any bruising or cuts that could have happened during the delivery process. So I'm going to flip her over. Again, just moving the hair to look for that bruising or any cuts. Alright. And then while I have her turned over, I'm just going to check her spine. So her spine is smooth. It's a straight line. And I'm not seeing any dimples or hair tufts back here in the sacral area, so that's good. Her back, her diaper's down, so also her buttocks, light pink in color. I'm not seeing any peeling, rashes, bruising, lingual vernix, so everything is good here on the back side. I'm going to flip her back over here. So then with her eyes, I have 1/3, 1/3, 1/3. So they're in the correct placement. They're symmetrical. There's no epicanthal folds. I'm not seeing any discharge or subconjunctival hemorrhaging. So then I'm just going to follow the eyes out here. Alright, to the top of the ears. So the ears are in the correct placement. They're symmetrical. I would bend the cartilage forward. So hers went back instantly, just meaning that she is a full-term baby. I'm going to come down and check the patency of her nares. So I'm going to close one side, make sure I can feel her breathing. Close the other side and make sure I can feel her breathing. And now I'm going to don gloves. So I'm going to go in and I'm going to feel for the hard and soft palate to make sure that they've formed. And then I'm also just checking her sucking reflex while I'm in here. She's sucking, so that's good. All right, and then as I've been doing the assessment, she's been looking around, kind of like following my voice, so I'd say she has a full range of motion. All right, so I'm just going to palpate her neck here. I'm not feeling any masses. I'm going to come down, make sure her clavicles are intact, so we're good there. I've already listened to her heart, listened to her lungs. I've done the abdomen and the umbilical cord. All right. So I'm just inspecting the chest and abdomen real fast again. All right, so her arms, again, so arms, abdomen, and chest. I'm not seeing any peeling, the rashes, the bruising, languo, vernix, birthmarks, light pink in color everywhere. I'm going to count her fingers. There's 5. There's 5 there. I'm going to flex her arm up and hold it for a few seconds, and then let it go. And then as a reflex, she should flex it back up again. While I have her laying here, I'm going to clap my hands like really loud, or like lift her mattress up a little bit, and then drop it. And then as I do that, she should also like kind of clap her hands in a reflex there. So good there. So I'm going to move down here. All right, and then I'm just inspecting her thighs and feet real quick for color-wise. Again, pink, no peeling, vernix, languo, scratches, birthmarks, rashes, bruises, anything of that sort. So I'm just going to touch to double check for jaundice. So I'm doing her forehead, her chest, her abdomen, her thighs. So no signs of jaundice there. And then I'm just double checking in the sclera of her eyes. They're white. There's no yellowing. No signs of jaundice anywhere. So she's good there. I'm going to come back down here to her feet. I'm going to start on the outer edge and J up here. And her toes should fan out, which is good. And this is the Babinski reflex. And then again on here, the toes fan out. So that's good. Oops. All right. So I'm going to take her diaper off. So I am just double checking if she has any discharge. I would note that it is okay if she does, just because from all the mom's hormones. I'm making sure that the labia majora are fully developed, and that they're surrounding and kind of covering the labia minora, and then also making sure that the labia minora and the clitoris are formed and that I can see them. If it was a boy, I would note I would do the, note the amount of rugae on the scrotum. I would find the urinary meatus, which should be at the tip of the penis. I would palpate to see if the testes have descended. And then I would also note if he's circumcised. And then while I was inspecting down there, obviously if they had a dirty diaper, I would change that. And then I would also ask the mom the last time that the baby has urinated or voided, and make sure that they haven't had like any difficulties or abnormalities there. And then I would also ask when the baby's due to be fed again. I've tried to keep her warm throughout the whole process. She's been really pleasant. She hasn't been like screaming nonstop, or been super upset. She's kind of been a happy baby. Like I said, her range of motion is good. I think that's it.